can I come in?
Yes.
Hi, I'm Bernelia. My name is Bernelia, and I will be your nurse today. I will be doing an assessment, a head-to-toe assessment on you. You have already told me your name, your date of birth. You have already told me what the president is. So you're alert and oriented ×4. I will be washing my hands, and I will be pulling the curtain for your privacy. I will be looking at your armband, and I'll be checking your name and date of birth. And your name and date of birth, and that's correct. I will be doing your vital signs, your temperature, your pulse, your respiration, your blood pressure, and then the next thing I'll be doing is assessing from your head, all the way down to your toe, to your feet. I'll be taking a look at it. If anything hurts, please let me know. I will try my best to be, as gentle as possible. So I'm going to take a look at your head, and I'll be feeling to see if there is any bumps. And can you raise your head up a little bit for me? I didn't feel any scar, no bald spots, and I'll be washing my hands. I'm gonna take a look at your ears, and if you just come over this way for me. Your ears is nice, pearly gray, and I'm gonna move on to this one here. Other ear is nice, pearly gray. And if you look straight for me, I'm going to take a look at your eyes. I will be checking your pupils, see if they constrict when I shine the pen light in, and your pupil constrict, and your pupil constrict. Can you pull your lid down for me, your eyelid? Nice and pink. Their conjunctiva nice and pink. There's no drainage. Sclera is white. And I'll be looking at your nose. There's no polyp inside her nose. They're nice and pink inside, and they're symmetrical. They're midline. I'll be taking a look at your mouth. If you can open your mouth for me. And your teeth, no dental caries. No loose teeth. And if you could stick your tongue out. Tongue is nice and pink. Oral cavity is pink. And I'll be using my tongue blade to look at her. If you could open up your mouth, look at your vulva. Your vulva is in midline. And I'm doing your assessment, but I'm also checking, your facial expression. I'm looking at your face, if it's midline. No Bell's palsy. If no Bell's palsy noted. Conjunctiva is pink. Next, okay, next. I'll be listening, to your heart. I'll be listening for your heart sounds. So I'll be feeling, that's your sternal notch, your second intercostal space, right, second intercostal space, right sternum border, the aortic, left intercostal space, left is their pulmonic valve. Then I'm going down in a zigzag motion, and your third intercostal space, is your Herb's point, and there's no valve, and it's a dub. The fourth intercostal space is the tricuspid valve, and the fifth intercostal space, mid-clavicular, is the mitral valve, and this is where the apical pulse is, and you listen for the apical pulse, for 1 full minute. Next, I will be listening to your lungs. I'll be listening for abnormal lung sounds, any crackles, any wheezes, or any stridor. The apex, the second intercostal space, the right upper lobe, and I'll be moving over to the second intercostal space, the left upper lobe, then I'll move down to the fourth intercostal space, the left upper lobe, and then the fourth intercostal space, the right middle lobe, the sixth intercostal space, mid axilla, is the right lower lobe, and the sixth intercostal space, mid axilla, is the lower lobe. Posteriorly, let me turn over a little bit for me. Posteriorly, from C7 to T3 between the shoulders. If you could stretch out a little bit for me so you could move your scapula away from between the shoulder blades is the right upper lobe and the left upper lobe. From T3 to T10 is the right and left lower lobe. And if you could turn over for me. I will be listening to your abdomen. And I will divide our abdomen in 4 quadrants. The right, I will begin from the right lower quadrant. And I will be inspecting, auscultating, percussion, and palpation will be the last. So the right lower quadrant, and then the right upper quadrant, the left upper quadrant, I'll be listening. And I will listen for 3 to 5 minutes. If it's a normal bowel sound, and if it's abnormal, I listen for 5 full minutes. And then I move over to the left lower quadrant. Next, I will be checking, for circulation. And your fingers are nice and pink with good circulation. And can I check the other one? And your fingers nice and pink. And can you move your arm up for me? No crepitus. Huh? And no crepitus. And I'll be moving to your lower extremity. I'll be feeling for your popliteal pulse. Are you having no pain in your abdomen? No pain? Are you urinating okay?
Yes.
Okay. And I'm gonna ask you if you could sit up for me. And if you could turn around. And I'm gonna check you for upper strength. I'm gonna put your hands up like this for me, and I'm gonna pull, and don't let me pull, just hold it firm. Okay, just keep it firm, and I'm gonna pull, and don't let me pull. Okay, upper strength is okay. And then I'm gonna ask you if you could stand up. And walk towards here and then you could turn around and you walk perfectly fine and there is no sway. Then you could sit back on the bed and you could put your legs up. And your assessment is completed. There is no bald spots in your head. There's no bump. I mean, there's no open area. Your face is symmetrical. Your eyes, your pupils constrict. There's no drainage from your ears. Your nose are patent. Your lips are pink. No dental caries. And your mucous membrane is nice and pink. There's no abnormal hard sounds. No murmur. Your lungs are clear. There's no wheezing. Noted. Your abdomen, is flat. No distension. Your bowel sounds are present. I didn't palpate any mass. Your nail beds are nice and pink. And no sway, during when you walk. There's no sway. You're not complaining of any pain. And I have completed your assessment, and thank you for your cooperation. I will let your doctor know, and I will give him update on what I observe. I will put your call light beside you on your bed. If you need anything, do not get up unassisted. You put your call light on, and I will pull your rails up, and I'll wash my hands, and thank you.